How do I make the best transitional cell carcinoma treatment choices? When facing a diagnosis of transitional cell carcinoma, understanding your options can feel overwhelming. Making the best treatment choices starts with knowing your specific diagnosis, including the cancer's stage, grade, and risk level. Working closely with a healthcare team experienced in bladder cancer is essential. They will help tailor your treatment plan based on your unique situation, overall health, and personal preferences. The first step is understanding whether your cancer is non-muscle invasive or muscle invasive. Most initial cases are non-muscle invasive bladder cancer, which means the tumor is confined to the lining of the bladder without invading the muscle. These are further classified into low, intermediate, or high risk depending on tumor size, number, grade, and whether carcinoma in situ is present. Accurate staging and grading through cystoscopy and biopsy are critical to determine the right approach. The standard initial treatment for non-muscle invasive bladder cancer is transurethral resection of the bladder tumor, or TURBY. This procedure involves removing visible tumors from the bladder lining, which helps confirm the diagnosis and provides initial treatment. After TURBY, your doctor might recommend intravesical therapy, which involves placing medication directly into the bladder. For low-risk cases, a single dose of intravesical chemotherapy, such as mitomycin C or gemcitabine, given within 24 hours after TURBY, can help reduce the chance of recurrence. For intermediate-risk patients, a 6-week course of intravesical chemotherapy or immunotherapy, like Bacillus calmette-guerin, is often recommended. Sometimes, ongoing maintenance therapy is advised based on how well the cancer responds. High-risk patients, especially those with carcinoma in situ or high-grade tumors, usually receive a 6-week induction course of Bacillus calmette-guerin therapy followed by maintenance treatments that can last up to 3 years. Bacillus calmette-guerin has strong evidence supporting its ability to lower the risk of cancer coming back or progressing. It's important to note that intravesical chemotherapy is not recommended immediately after TURBY if there's concern about bladder perforation or extensive tissue removal. Monitoring is key after treatment. Regular cystoscopic exams are necessary to catch any recurrence early. The frequency of these follow-ups depends on your risk level, with high-risk patients needing more frequent checks. If the cancer does not respond to Bacillus calmette-guerin or comes back despite treatment, options include more aggressive surgery, like removing the bladder through a procedure called radical cystectomy. Some patients may also be eligible for clinical trials exploring new therapies, including advanced intravesical agents or systemic immunotherapies. Emerging treatments are being studied for patients who cannot or choose not to have surgery. For muscle-invasive bladder cancer, treatment usually involves removing the bladder entirely, often combined with chemotherapy or radiation therapy. A multidisciplinary team of specialists will evaluate your case to recommend the most appropriate approach. Remember, every patient's situation is different. Decisions about treatment should always involve a healthcare team experienced in bladder cancer. They can help weigh the benefits and risks of each option, considering your health, lifestyle, and personal goals. Making informed choices with your medical team ensures your treatment plan aligns with current guidelines and best practices. In summary, making the best treatment choices for transitional cell carcinoma involves understanding your diagnosis, choosing appropriate therapies like TURBY and intravesical treatments, staying vigilant with follow-up exams, and considering surgery or advanced therapies if needed. Always consult with specialists who can provide personalized advice based on the latest medical evidence. Your healthcare team is your best resource for navigating these complex decisions safely and effectively.